I'm Dr. Sunil Richardson. I'm a maxillofacial and craniofacial surgeon. I practice out of South India currently. Now we have with us this pretty girl. She's 11 years old. Her name is Anushka. Now Anushka was born with cleft palate. I did her cleft palate repair more than 10 years ago. Anushka operation பண்ணி எவ்வளவு வருஷம் ஆகுது இப்போ கரெக்ட்டா? 10 years. எந்த வருஷத்துல பண்ணோம்? 2011ல பண்ணோம். So 2011 her surgery was done and I'd done her palate. She was just born with a cleft palate, no cleft lip, and she's come here 10 years after that. Never has she seen me before. She's not been to any doctor. She's not got any treatment and she speaks beautifully. Now I'm not saying this is the best way it should be done, but in spite of our repeated advice to our patients, some of them just don't turn up because they don't think there's any problem. She's come to me now because she had some pain in the throat and so they suddenly remembered that there was a cleft palate I operated a decade ago and her mom has got her here. Right. இப்போ எதுக்கு வந்தீங்க? தொண்டல வலி இருந்தனால. இப்போ Okay. So she says she has some pain in the throat, so she wanted to come over. 10 வருஷம் ஏன் வரல? So she doesn't know why she hasn't got her daughter for 10 years. Anyway, I know why she hasn't got her for 10 years because she didn't have a problem. Only a person with a problem needs a physician and she's absolutely fine. Right. உன் பேர் சொல்லுடா.
Anushka.
பயமா இருக்கா? She's also a good singer. 1 2 3 சொல்லு first 10 வரைக்கும்.
1 2 3 4 5 6 7 8 9 10.
சரி, அம்மா பேரு?
Sindhu.
அப்பா பேரு?
Suresh.
Okay, school?
Anikare.
எந்த பாட்டு பாட சொன்ன நீ?
உம்மழகான.
பாடு.
உம்மழகான கண்களென்னை கண்டதாலே முடிந்ததென்று நினைத்த நான் உயிர் வாழ்கின்றேன். உம்மழகான கண்களென்னை கண்டதாலே முடிந்ததென்று நினைத்ததான் உயிர் வாழ்கின்றேன். யாரும் அறியாத என்னை நன்றாய் அறிந்து தேடி வந்த நல்ல நேசரே. யாரும் அறியாத என்னை நன்றாய் அறிந்து தேடி வந்த நல்ல நேசரே. உம்மழகான கண்கள் என்னை கண்டதாலே முடிந்ததென்று நினைத்த நான் உயிர் வாழ்கின்றேன். யாரும் அறியாத என்னை நன்றாய் அறிந்து தேடி வந்த நல்ல நேசரே. தூக்கி எறியப்பட்ட என்னை வேண்டுமென்று சொல்லி சேர்த்து கொண்ட நல்ல நேசரே. உம்மழகான கண்கள் என்னை கண்டதாலே முடிந்ததென்று நினைத்த நான் உயிர் வாழ்கின்றேன்.
Thank you. So now the most important thing, I'm going to show you inside her mouth. Now I did mention to her, I did a cleft palate repair more than 10 years ago for her. She has a very good moving functional soft palate. You can also see how clearly and beautifully she speaks and sings. But her uvula is not that perfect. We're going to have a look inside her mouth now. So you can see that the uvula is still kind of bifid. So I would not rate that palate repair very high. Wouldn't definitely score a 10 on 10. But you can still see the palate is large and wide and it's moving. So that's the important thing. Jalma? Okay. So the palate was moving. A functional palate doesn't mean that the uvula needs to be nice and full. This is the take-home message. I've seen a lot of patients in my last couple of decades of cleft work that the uvula muscles are important, yes, but just because the patient has a bifid uvula doesn't mean that they don't speak well. The most important aspect are the muscles in the soft palate the tensor veli palatini and the levator veli palatini. These muscles move like a hammock, like a spring. They go, they touch the posterior wall of the pharynx, and then they come back and retract when we don't speak. If that mechanism is reconstituted perfectly at the time when these kids are babes, about 10 months old, as they grow, as you've seen in her case, and in many hundreds of our patients, they tend to speak well, even if they have never met a physician afterwards, even if they've had no episode of speech therapy, and even if they have a bifid uvula, as in our case. So the take-home message again, friends, is that a proper cleft palate repair can make these kids just like one of us. You can check our channels and find a lot of our patients who also sing well and even get awards. She's not getting any awards right now, but her speech is good. Her parents have no complaints to speech. She goes to school well. She's not studying very well though, her mom told me. Yeah, she's more interested in playing and singing. And anyways, her speech is good. Right? அடுத்தது நீ வருஷத்துக்கு ஒரு வாட்டி வரணும் நீங்கள் சும்மா காட்டுறதுக்காது. ஏன்னா ஏதாவது வளரவுள்ள பிரச்சனைகள் இருந்தால் நான் உங்கள்கிட்ட சொன்னேன் இல்லை, நம்ம ஈஸியாக பார்த்து சரி பண்ணிடலாம். ஒன்றும் இல்லை இவளுக்கு, நல்லது. பட் ஒரு வேலை தான் இருந்தால் நம்ம அது பார்க்குறதுக்கு ஈஸி. சரியாடா? ரைட்? தேங்க்யூ.